they have options that they can help their body to heal without depending on what their doctor says or nutrition. So, inflammation and joint pain is the focus, but from what we know, inflammation is involved in so many chronic disease conditions. So it's not just joint pain, but that's what we're used to thinking that is involved.
There you go.
I'm starting with a medical definition, which is like a lot, but the key that I want you to take out of this is that it's a response to local injury, and the purpose is to help the body heal. So when there is cell damage or tissue damage, the cell releases some biochemicals that will cause the tiny blood vessels in that area to dilate. The purpose is to bring white blood cells and other cells that help in healing, the immune cells. So it's local, and the purpose is to eliminate the toxic agents in the local area. And the signs of inflammation, the redness, the heat, the pain, and the swelling is because of that capillary dilatation, increasing blood flow to the areas. But the purpose is to heal. So I'm going to talk about acute and chronic inflammation, because we think of inflammation as a bad thing. You know, oh gosh, I got this flame, it's bad. But from that definition, you know that the original purpose is to help your body to heal. So when it's acute, then the inflammation occurs at the site of the injury, so it's local. So that all the processes that happen with inflammation is to localize the area, contain the area of damage, so that the body can heal. If you have a cut in your finger or sprained ankle, if you leave it alone, yes, there is pain because of that inflammatory process, but eventually it will heal on its own. But it's short term, it shouldn't heal on its own. So if you have something that does not heal, like local inflammation, then maybe there's something else going on. So chronic inflammation, this is really the one that we should all be concerned about, chronic inflammation, because it is low grade. Sometimes we don't even know it's there, but there are triggers. If we are chronically exposed to those triggers, then we will continue to mount this inflammatory response. And again, because inflammation is supposed to heal an area, it's supposed to heal damaged tissue, right? So eventually it might cause damage in itself. And it will continue until some of these chronic disease conditions that we have, like fibromyalgia, multiple sclerosis, because it's systemic. And the sad thing about it is that for local inflammation or local acute injury, you know what caused it. So you stop exposing yourself to it. But a lot of the chronic triggers, we don't even know that it's causing inflammation in our body. And it will continue to cause damage until it will damage the organs. Things like the arthritis, the rheumatoid arthritis, it goes on for so long that sometimes it's even irreversible joint damage. Some people get hip replacement and stuff like that. And even something like heart disease, Alzheimer's, due to inflammation, but it's systemic. So what are some of I'm going to focus on the food triggers. There's a lot of triggers of chronic inflammation. I'm talking about chronic inflammation now. Some of the triggers, infections, chemicals, heavy metals. Dr. Perkins will talk more about some of the other things. But I'm going to focus on the food. Food triggers, refined carbohydrates, sugar. Sugar is the same thing as refined carbohydrate. They all act the same way. They will cause inflammation. So can you imagine if you're eating sugar or refined carbohydrate every day, then you have so many diseases that are so removed that you will never link them together. The medical system does not even link those things together. But something as simple as food can cause somebody to have heart disease, to have Alzheimer's, to have the arthritis and all the other lupus, all those things caused by food. Processed meat, the chemicals that they use to process, like the deli meats, it's a lot of chemicals that your body will consider as a noxious substance. It's a toxin to your system. So your body is going to try to fight it by releasing those inflammatory cytokines that will eventually damage the area. Hydrogenated fats, I mean, they're not real. Like margarine is not real. You're better off eating real butter, right? Than any of these hydrogenated fats, because it's not natural to the system. It will cause your body to mount an immune response against it. So this is just a picture of some foods. So these are the inflammatory foods, the fried foods, the sodas, refined carbs, lard, processed meat. But then there are some foods that are anti-inflammatories that can help your body even fight some of those low-grade inflammation. So if you're eating foods like tomatoes, fruits, vegetables, nuts, and fatty fish, then even though in the environment we are exposed to a lot of inflammatory triggers, but if you're eating the right food, it will be enough for your body to fight off those things. Okay, then for treatment, sometimes for inflammation, I will recommend the herbs, the natural supplements. In the medical system, we use NSAIDs, non-steroidal anti-inflammatories, the steroids. They're effective. They will suppress the inflammation. They will reduce the pain. You won't feel the pain. But guess what? The trigger is still there. The problem is still occurring. So some of the side effects of the steroids are even worse than whatever caused the inflammation in the first place. Steroids, I've said this before, steroids have negative effect on every organ system in the body, every single one of them. Yes, they are very powerful anti-inflammatory. They will, when you are in very severe pain or severe inflammation, yes, you're going to need the steroid, but let it be short term until you figure it out. Unfortunately, with our medical system, we don't figure out what the cause is. If you don't find what the trigger is, you're not going to eliminate it. And then you find people on steroids for a long time with all the side effects from steroids. And steroids will also even prevent your body from healing, because you suppress so much of the immune system, the healing system, that it doesn't happen. Some of the rheumatoid arthritis medicines, they call them disease-modifying anti-rheumatic drugs or biologics. They suppress the immune system completely. They can lead to very severe infections. So I would rather use the herbs like turmeric, omega-3 fatty acid, boswellia, bromelain. There's a whole list, even more than this. There's a lot of natural herbs. Yes, they can suppress inflammation, but not to the extent that the drugs do. They're as effective in relieving pain, but at least they will allow some other factors that allow healing in your body to take place if you use them. So what is the solution? From my point of view, solution to chronic inflammation. It's an integrative solution. Since there's a lot of different things that will cause chronic inflammation, the chronic triggers, it's important to identify what the underlying cause is. If it is food, you have to identify the food. Not just the refined carbohydrates or the fried foods or the general food recommendations, but everybody is different. There are people who cannot tolerate certain foods. If somebody cannot tolerate wheat or grains, it becomes and they're eating those foods every day, it becomes a trigger for them. They have this low-grade inflammation over years, and they'll start coming down with some chronic disease condition that you don't know where it's coming from. I had that issue, it was grains for me, and it led to so many conditions. You could not believe that food was the only thing causing my thyroid to go down, my joints, my digestive issues, everything was wrong with me, until I found out that I have this sensitivity to grains, and stop eating them. For some people, it's pathogens. There are fungus, bacteria, viruses that might be in your system that you don't even know about. They're not that kind of virulent that they will cause you to have, an infectious episode. But they're in there. If you don't address them, they will continue to trigger inflammatory response, and eventually will cause damage to one organ or the other. Because for everybody is different. For some people, it will be the heart muscle that gets affected. Some people, it will be the brain. That brain is Alzheimer's. For some people, it's digestive system. So once chronic inflammation exists, it could be systemic. It can cause damage to any organ of the body. So it's not just the joints. But we focus a lot on joints, thinking that that's the only place we have inflammation. And the chemicals, the heavy metals, sometimes, even with joint pain, you've tried everything. If it is caused by heavy metal like mercury or whatever, if you don't eliminate those, you're not going to heal. I mentioned misalignments, like we have an osteopathic physician here that does manipulations. You have chiropractors that do adjustments. What you find that if it's due to misalignment, that's what's causing the inflammation, it will go away, right? But sometimes it's not just one thing. It could be, there's misalignment, and there's also nutritional issues, either toxins present or nutritional deficiency or intolerance. You will keep adjusting the same joint, and it does not hold until you resolve the nutritional issue. So the number one thing is to identify the problem, find the cause to eliminate it, and then use whatever therapy it is. Yes, combination of therapies. You need the adjustments, the manipulation, or whatever you have to do. But also consider if you keep adjusting the same joint over and over again, maybe there's something else. So you have an integrative approach. And then I like to use food-based supplements, because food is like medicine. The food-based supplement, there's a lot of synthetic supplements, but food-based medicines, they contain enough ingredients to do whatever your body needs to heal. It's detoxification, there are things, even something like cilantro is very good, chlorella, spirulina, they're so good for detoxification, to remove heavy metals from your body, to remove chemicals. Sometimes, yeah, in food sensitivity, you need enzymes to help break down those food. So there are so many things that you can do in addition to structural work to be able to make sure that the inflammatory process is contained, so that it doesn't allow damage to the extent of a chronic disease. So I am going to let Dr. Parkins take over and talk about some of the other causes of chronic inflammation and what else to do about them.
All right. Thank you. Okay.
Do you want me to do her too?
Yeah, or do you think I'm just shocked? I should know by now. What should I? No. Okay, there was one of two. Maybe I'm not in the win the lottery for it. Okay, recap. Inflammation good or inflammation bad?
Bad.
A little bit of both. Acute is good, chronic is not.
Okay, so now we know who our teacher's pet is. Typical, on the farther front of the room, good. The roadies are maybe in the back. That is true. The answer is, it depends. I was always sitting in the back, by the way. Oh boy. Okay, so the answer is, it depends. And by the way, if you come to my seminars frequently, the answer 9 times out of 10 is always, it depends, so just remember that. You'll have the heads up, right? Short-term, acute, is actually life-saving. If we did not have the ability to go to war and create like a mega inflammatory type of war against whomever the invader is, we wouldn't be here talking about it. We would have, like I say, men can die from having a cold, women can't. But nevertheless, it's actually life-saving. Long-term, that's where it gets fishy, and that's when we don't want it. All right? Dr. Mondo spoke about several different causes. Sometimes it can be a little confusing because some things can cause the inflammation and some things can be caused by inflammation, and it kind of be the same. So she talked relatively extensively about foods. If somebody's going to charge you to give you advice about anti-inflammatory food, you can do that on Google. You don't need to pay somebody to do that. So we're all about customized medicine. Dr. Mondo does not do that. So you're going to end up knowing exactly what you are reactive to. So it's not the trial and error. You can do trial and error all day long if you feel like it. It's going to take you a year and a day. Who's got the time for that? Got no time for that. So she's going to find exactly what is, and she's going to, consequently, it's antidote too, right? When we know what we're fighting, we know what tool and what weapon to use to counteract it. So very time effective. And please take advantage of the fact that we keep on telling her to increase her price and she keeps on refusing to do so. 60. You can find out everything you want to know about it. A sedentary lifestyle, our infections, insomnia. I've learned so much stuff coming up with this seminar. You wouldn't believe it. I would turn around, did you know? I did not know that. How awesome is this? I did not. Well, it kind of makes sense that insomnia, when they say that that's when our cells do repair themselves. And so if you cannot sleep, your cells don't have the ability to repair itself, and there we go. Injury, self-explanatory, right? That would be our acute, that would be the desirable one. Toxins. We've had 2 fun cases, right? As long as I don't tell names. So Santa Claus comes to us, and he is truly, and that's a true story, absolute, picture-perfect epitome of health. The man is a personal trainer, eats organic, works out every single day. I mean, you're just like 6% body fat, whatever, right? He comes in for shoulder pain, which is to be expected. You know, they pump iron all day long and all that good stuff. I'm like, okay, orthopedic, easy, treat him better, but his pec muscle is twice the size on one side than the other. Well, unless you're Roger Federer and you whack the tennis racket a million times, then you, to be expected, you're going to have one side that is twice the size of the other. But it was not the arm, and the injury to the shoulder was not big enough to justify this huge pec on one side. All right. Shoulder feels better, he comes back. I brought the pec down. He comes back, pec is twice the size of the other one. It's like, how's the shoulder? It's like, oh, almost gone. I'm like, well, that makes no sense now, because now I know that there's a lot of inflammation there. I should have a lot of pain, but I really don't. I'm like, right. It's like almost like the tricky candles, cake candles that you blow and then they relight up again. I mean, I just kept on blowing that pec, and then it kept on growing back again in a week. So fast forward, maybe a month later, he comes in OMG. He looks like a 90-year-old. He just can barely move. He's like, I don't know what's going on. I'm achy everywhere. I feel like I'm 100 years old. I think I'm dying. So the wife, I don't know her, I've never met her. The wife says, this is it. You're gonna go to a real doctor. Enough. So, I can't blame her. I think I probably would have said the same thing. Okay, so he goes to the real doctor. The real doctor gives him what? Steroids. Right course of action. The man can't move. Correct. Good. He feels better for a couple of days. The course is 10 days. 2-3 days after he's done with his course of antibiotic, 90 again. He comes back almost like, don't tell my wife I'm here, but I don't know what to do. I feel like you're protected with HIPAA unless she saw you walk in here and you're okay. So I'm thinking to myself, okay, it's not orthopedic, it is systemic, because that pec cannot grow that fast. We did steroids, it confirms we have inflammation. Where in the world is this inflammation coming from? It's inside his body now. Like, I got peeps, we're okay. Dr. Wando, me too, I call her Wando. Wando, like, I need for you to find out what's the toxin. She's like, I'm on it, boss. I'm like, great. So she does her test. It's cadmium. Like, what's that? Catnip? Catnip? What? Catnip? Where do you lick that? Is that where is that? So we look. The guy's like, well, I don't know. I bought a ring online, maybe. I'm like, no, dude, that's not enough. It's like, it's more than that. It's more than that. Where is it? Where's the cadmium? Where? So, make a long story short, which I've said that 3 times, but I'm almost done with that story. One night he's cooking, and then somehow he's looking, and don't judge, his wife has her own pan to cook her own dinner, and he has his own pan, and there is no sharing. He turns around and he sees on the side of her pan cadmium and lead free. So he's just like, oh my, I am wondering if my pen is, and so he went and researched online, and sure enough, his was not. So his pan went to the door. He had to negotiate borrowing hers for, and so we had to do what? We had to stop fueling the fire. I mean, give a sister a break. If you want me to take the inflammation out, but you keep on pouring it in because you don't know where and how, well, you can't tell me, hey, sis, I'm still inflamed. I'm like, well, hey, brother, stop putting it in. Where is it coming from? So we go back and forth. We identified what it was. When we identified where he was getting it from. He was cooking his meals, his organic meals, tinted cabin. Mind you, true story. I wish he was here. And so he stopped doing that. We did heavy duty detox. We did this, we did that. Meanwhile, they had come with RA diagnosis, spooky stuff, right? And he spontaneously cured. Whee! So that was one of the fun, I have bazillions of those, fun cases that when inflammation comes along, when it doesn't make sense, rest assured, we will not go to sleep until we find what is going on and how we're going to turn around. That's fun. I told you one of my heroes, Dr. Cluso. I'm like, I'm the mini version of Dr. Cluso. Inspector Cluso. Dr. Cluso. I'm French. Okay, I mixed the two. Done. Check. We can move on now. Illnesses. Stress is a biggie. Stress causes everything, right? Okay, we've talked about many things that we would not. Would I have linked depression and anxiety to inflammation? I don't think I would have connected those dots. But it's possible that it could be caused by a chronic underlying inflammation. And if it is the case, maybe our anti-anxiety, antidepressive, and type of medication is good, but we just kind of keep on missing the target. So like, okay, well, how do I know then if I have inflammation? There's an app for that. There are some tests that will test. That's Western medicine, so I don't know much. I Googled it, so don't hate me for that. Is that true, Dr. Hadley?
It sure
There's
is.
those two
And
tests.
also, Cedric.
It's Google, so it must be right.
And Cedric, yeah.
SB and the CRP. These are two types of tests in the West that could help detect chronic inflammation. Or like I just said, Dr. Guanda will tell you. One way or the other. Okay, it is serious. I like to keep it light and I kind of try to make it somewhat funny. But there's over 125 million of us that have chronic inflammation disease. And 61 million of us have more than one. So it concerns the majority of us or at least should. All right, we've talked about this. No need to beat a dead horse. I mean, if it's gonna damage your DNA, that's pretty spooky.
Can you
It was a
repair
five.
DNA damage?
Excuse me?
Can you repair DNA damage?
Here, DNA. Well,
Any tissue can regenerate. Yes, it can.
yeah, there's a different opinion, east and west. And in the west, we believe that just about every cell can be replaced, and if it's beyond repair, we just get rid of it. That's true, like skin cells, right? Red blood cells. So when there's just like, okay, your life shelf has expired, thanks for your good work, we don't need you anymore, we're gonna make new ones. But we used to think that brain cells were not regenerating. Now we seem to be not so sure that it's true. So whatever we tell you, in 10 years from now, come back and we tell you that everything else is true, and that we are finding new stuff. That's true. I've been in the medical field now for almost 30 years, and I apologize for what I said every decade thereafter. So I'm doing the apologies for 10 years from now. If you have friends that believe that the Motrin, the Advil, the Aleve, and all that fun stuff is a version of Skittles, it's a problem. If you do that, that means you have inflammation. You can keep on doing that, or not. That is fascinating. Metformin, and statins are in the category of anti-inflammatories. I never knew that. It's okay, I'm not supposed to know, right? It's not my medicine. But nevertheless, I thought statins, that's for cholesterol, and metformin is for diabetes. That's in the category of anti-inflammatories? That's fascinating. That means that we are now considering a layer of the cholesterol being an inflammatory type of disease, and so is diabetes. Huh. I know, some of you already know that, or shaking their heads, I didn't know. Okay, stop fueling the fire, right? Obvious. How do you know if you're fueling the fire? Well, there's a variety of ways to know. The trial and error is not recommended. Once we know what it is, then you stop fueling the fire, then we start detoxifying you. How we do that? We detoxify through herbs. We can detoxify through infrared therapy. So infrared therapy is a technology that's been used on this side of the pond for 40 years. That is what we actually use in incubators to keep our little preemies warm. So if we can use something on a preemie, that's safe, right? It warms up the body from the inside out as opposed to from outside in. It promotes increased circulation, sweating, and you just start It's different from a steam saunas and all that good stuff. Lymphatic drainage. If you were there last time, I referred to, if you are a cesspool, like, okay, I'd have to come up with something a little bit kinder. Like a pool filter, when the pool is all full of algae, we look at the filter, we pull it out, and it's all clogged up and all dark and black and green and all that good stuff. We take a hose, we hose it down, we plop it in, and then the new water can go through, be filtrated, and put back in, and then that process done over and over again will make your pool clean. Your lymphatic system, if your lymphatic filters are clogged up, it's like the parking space is full. So you have to wait and wait and wait. So you recirculate your toxins over and over and over again, and you're not making strides forward very fast. So there is a technique called lymphatic drainage. It's done one of two ways. Before technology was done, we had to do it manually. Tough. Tough. You have to have the perfect pressure 100% of the time. And that pressure is not easy. If you're too light, it's not doing anything. If you're just a teeny bit too deep, it's squeezing it, not doing anything. So you have to be creating perfection for 60 minutes. That's rough. It takes years to master. So I thought, okay, I need to standardize when we do it here. If somebody is not working for somebody and we did it on you, then if I did it, then I know what I did. But if one of my therapists did it, I don't know what they did. So is the technique not working for you, or was it not done right? I don't know. So I'm like, okay, there's gotta be technology out there, which there was, and I found it. It's called electro-lymphatic drainage. So they studied the vibration, the resistance of the lymphatic flow, and then with a combination of light, sound, and electricity, they perfected the perfect combination so that when we use it, we just move and clear out the lymphatic congestion perfectly 100% of the time. That's pretty amazing stuff. There's about only 5 people in this county that does that. Yes, did you have a question, Mary? Or were you just stretching? I'm not putting you on the spot, but, oh, ignore me, I'm good.